So for this video, I'm going to demonstrate a few techniques for collecting needle aspirates. This will be used for masses under the skin, for lymph node aspirates being the two most common. And there are different techniques, and the best technique really depends on the situation. Most of the time you're going to want to use a bare needle and pass the needle multiple times through the structure. Sort of in a back and forth. Some people call it like a sewing machine needle action or a woodpecker type action. The type of needle that you might want to use, you can get really excellent samples with 25 gauge needles, a little bit less hemorrhage with a narrower gauge needle. We happen to use the long ones, so we have a little bit more of a shaft to collect the sample. As you're shearing off cells with each pass, you collect a little bit larger sample. The downside to this particular brand is that the hub of the needle is pink, and so it makes it a little harder to see when there would be red blood coming into the shaft of the needle, which is valuable. As soon as you see blood filling up the hub of the needle, you need to stop. You need to pull out because you're losing good sample in the hub of the needle. What's stuck in the hub usually doesn't end up on the slide, and so there's no point in continuing to do that after you get a flash of blood. So if you happen to have one that isn't pink, that's a little bit better. So the 25 gauge 1.5 inch needles work very well. Most practices have 22 gauge 1 inch needles, and those also work fine. I use them both, and so both of them can be okay. And so there's the bare needle technique, non-aspiration technique as it's called. And so we have this creature here that has a little tumor under the skin. And so for the non-aspiration technique, you're going to insert the needle and move it back and forth multiple times in different planes, trying to sample more areas of the tumor than just one. And so you're just passing it back and forth. The speed is, doesn't matter all that much. And you pull the sample, the needle out, and you're going to put some air into the syringe relatively quickly, attach it to the needle, and you want to put your sample in the sort of the middle of the slide, more towards the frosted end. And you're just going to spray it. I disconnect the syringe from the needle, put more air in. I can spray more of my sample on the slide. I'm going very slowly here to demonstrate, but you'd want to do this relatively quickly. Then you want to try and make your smears, and what type of smear technique you use depends on what the material looks like. And so one of the most common techniques is to simply put the side of the slide on the other slide, rotate it down into the material, and then pull straight off to the end. So you've started off at an angle, you rotate it down into the material, and you pull straight off. And you end up with, I don't know if it'll show up on this, but a bullet-shaped smear. That's one technique. And I'll show you a different technique for making a slide with a viscous material. So this is a viscous material. As if you could have seen that, it actually made a little mound on the slide before I did the smear. If it's a very thin material, we'll demonstrate a different technique. So back to the sample collection, the other method you'd use is with a syringe attached. And in this case, it gets to the syringe handling exercise that we did, where you want to practice holding the syringe between your thumb and first fingers, pulling back on the plunger with your third, your ring finger and your pinky. And so the same general technique as far as moving the needle back and forth, but at this time you apply aspiration as you are going in different planes in order to get more cells exfoliated. You need to release the suction before you come out. If you don't release the suction before you come out, then the negative pressure you created aspirates most of your sample into the hub of the needle where it will be lost. So let go first, disconnect the syringe from the needle, put air into the syringe, reconnect, and spray it onto a clean slide, disconnect, add more air, reconnect, spray it onto a clean slide. And if you can see this material is slightly mounded. It's viscous. It sticks up from the surface of the slide. And so we would want to use that technique I just showed you where you rotate down in and push off. There are another way to do the same kind of technique, which works better for some people, is to actually hold the slide by the frosted end between your thumb and index finger, and you support the slide with your ring finger, and you take your clean slide, and my hands are in the way, and you rotate, you still butt it up against the side of the slide up against the slide with the sample on it, rotate it into the material, and pull straight down. And that technique works very well for some people, particularly if you have shaky hands. So both of them make perfectly good smears. It's really a preference on how you want to handle the slides. That would be a technique that you would use for viscous type material. And now I'm going to demonstrate what you might do if the material looks more like peripheral blood when it comes out. Many times tumors, for instance, are highly vascular and they may have a sample that is very bloody. And so taking clean slides, to make a blood smear, the key is to have a very small sample on the slide. When you're doing an aspirate, you might get a large amount or a small amount on the slide, and you need to be able to adjust your technique accordingly depending on how the sample is. But generally, a smaller sample than that would be better, because when you have a large drop like that, you have to work that much more quickly in order to make your smear. So one of the most common techniques is to hold your spreader slide between your thumb and your first two fingers, and you're going to put the slide at an angle, about a 30-degree angle, to the base slide. You're going to slide it towards the drop of blood, allow the meniscus to spread that blood out towards the edges of the slide, and then in a smooth motion push the slide forward in order to get that nice bullet-shaped smear. And so I hold the slide steady by putting my index finger of the other hand onto the slide. When you have a big drop like this, you have to work more quickly because it's a larger drop, it's going to spread more rapidly. So this is going to go quick. So, whoop, that was a bad slide. This is a perfect example of what not to do. So the problem with this slide is that although I do have a feathered edge, a lot of the cellular material is going to be stuck along this slide edge, and I've missed an opportunity. And so you're better off with a smaller drop to begin with, if you can. Okay, so a smaller drop, you're going to have an easier time doing a blood smear. And same technique, fingered on this, holding the slide steady, spreader slide between the other fingers, pull back, and then make a nice smooth smear to try and end up with a bullet-shaped smear when you're done. And ideally the blood sample does not spread all the way to the edge of the slide if you've done it well. When you have a sample like this one where I had a big drop, let's say it was a tumor it was a very bloody tumor and I got a large sample on the slide, I've got a poor quality feathered edge there where a lot of the cellular material might be, but a lot of the cellular material in a tumor sample is actually going to be in this thicker drop up at this end. So basically this is going to be too thick to evaluate, and it's not going to be a useful slide. So you can take another slide and salvage some from this slide in order to make additional smears. So one way to do that is simply to rotate down into the slide and then pull across in order to make another smear. I waited too long on this when it's starting to clot, so I didn't get a pretty slide on the spreader one. But I can demonstrate that again. And this is what I want you to do. it takes practice to learn these techniques. And the more you practice these motor skills at the beginning, the easier it's going to be for you to adjust to the material you get in a real life situation when you have an animal with you. And so you need to be able to handle when your slides didn't turn out exactly the way you wanted them to do, how you make the best of the sample that you have obtained. And so again, I'm just going to make a blood smear. So pull back, smooth motion forward, and not a bad blood smear. But I have this big drop here that's a lot of wasted material. So I can pick up that material by going acrosswise and make another smear. So now I have actually 2 decent smears for submission to the laboratory. And if you happen to have a lot of material on the slide, another technique is to actually rotate it down and actually directly pick it up from the slide. So I've actually picked it up on one slide, and then I can take another clean slide and smear that out as well. So you can make multiple smears from one sample if you harvest the leftovers on each slide. Again, adjusting your technique to the material that you actually achieve. So that's what you would do. So we talked about what you would do with a viscous sample, and that's a rotate down in and pull straight off. With what you might do if it looks more bloody, and you typically do the blood smear type technique, potentially with a salvage of whatever is left over at the other end. And then sometimes you're going to have material that comes out that is a very low viscosity. And if you have a low viscosity sample, thank you, then the problem is, because of the low viscosity, the surface tension between the slides as you put them together is going to essentially anneal the samples, the 2 slides together. It's going to make a lot of surface tension between those 2 slides. And if you were to pull them apart at that time, you essentially shear a lot of the cellular material that was on the slide, and you ruin your specimen. We see this all too often with lymphoma samples. The cells are fragile, and most of the cells are lysed on the cytology, and you can't make an adequate diagnosis. And so this is just diluted blood, but it's a lower viscosity. And so if you have something that is a lower viscosity sample, you could still do the blood smear technique if you move very quickly. But if you ever happen to, if you don't move quickly, let's just say that your hands are not perfectly steady, and you put the slide down and it spreads across the slide and basically anneals the 2 slides together. As you can see, I can hold it up and it doesn't fall off because they're being held together. If I were to smear this out at this point, I might very well lyse a lot of the cells that are on the slide. And so if you've made that mistake and the 2 slides are stuck together, you might be better off actually pulling directly straight up. The slide is not a pretty slide, admittedly. It's got very thick areas and thin areas, but at least I haven't lysed all my cells. And so then you can take a clean slide, and now that you have less material on there, you could potentially do a proper smear and end up with a smear that is a little bit more evenly distributed. Or if you had a little bit less than what I have on this slide, you might choose to do a touch imprint, where you literally lift up and touch the slide in multiple locations in order to get the sample smeared over the surface of the slides. Pathologists don't necessarily like these spotty samples because it's too thick in some areas and too thin in others. But around the shores of these little islands of cells, typically the cells are about 1 layer thick and are adequate for doing cytology. So if you make a mistake and the slides anneal together, you can of course get another sample, but you can still salvage the sample that you've got on your slides by doing basically techniques where you transfer some of the material from one slide to the next, avoiding that shearing action and actually just pulling up and touching the slide in multiple places to try and distribute the material more evenly. I'm just going to demonstrate a few additional slide techniques. So if you have a we talked about what to do if you made a mistake and the material's not very viscous in this, and you have a very small sample and the slides anneal together, how you pull them apart. So we'll see if I can demonstrate that again. This is a big enough sample you could do a blood smear technique, but if you happen to let the slides anneal together such that the sample is stuck, if I were to pull them apart at this point, I'd lyse most of the cells because these two slides are stuck together by surface tension. So this would be a little better example of that. Again, just pull up straight, and then I can take another slide and either do a smear technique with what's left, or potentially that where you pick up and you're trying not to lyse those fragile cells by merely doing a touch imprint around the slide. So you end up, it's hard to see because it's a thin fluid, but you saw the technique. So what if you have a really thin fluid, like what you'd get from a cyst? Most of the time it's not going to be a very cellular sample, so maybe you're not going to get very many cells from it. But there is a technique called a rollback for very thin fluids where, and I've got red cells here, so it would be more like a clear fluid rather than something that is red. But if you, instead of doing a traditional blood smear where you're aiming to go in as one smooth motion to try and get that feathered edge, when you have low cellularity fluids, if you actually go even slower, some people call it a rollback technique. If you go even more slowly, pull the slide back into the droplet, let the meniscus, the material slide and spread along the edge. And instead of going quickly, you're going to go very, very slowly. And in that interface between the two slides, the larger cellular material is going to spin in that turbulence at the interface. And so you're essentially going to pull down the cells towards the end. Some people call it a line concentration technique. And so I'll just demonstrate. So you go very slowly, so just let the material spread across the slide, and then go slowly down the slide, about halfway, and then pick up. And what you end up with is a line of material at the end where you're going to have the cells concentrated. Now, admittedly, the morphology is not as great because the cells tend to be a little bit crenated after they dry, but at least you have some cells to look at, as opposed to if you did a regular blood smear where you went quickly, there might only be one cell here and there, and it's hard to identify the cells in that fluid. So a line concentration technique or rollback can be useful for very low cellular fluids, things that are basically clear.